Assalamu alaikum everyone. Our next topic of discussion from first aid pathology is wound healing. So there are different mediators that are involved in wound healing. These are fibroblast growth factor, transforming growth factor beta, vascular endothelial growth factor, platelet derived growth factor, metalloproteinases, and epidermal growth factor. So we should know their functions. They all are involved in wound healing. First of all, there is fibroblast growth factor. It stimulates the process of angiogenesis. It is a process by which new blood vessels are formed from pre-existing blood vessels. Next one is the transforming growth factor beta. Basically, it is an most important cytokine for the synthesis and deposition of the connective tissue proteins. So it plays important role in fibrosis as well as it plays a role in angiogenesis. Next one is the vascular endothelial growth factor. As the name suggests, vascular, it is also involved in the process of angiogenesis. Next one is the platelet derived growth factor. As the name indicates, it is secreted by the activated platelets and the macrophages. It induces vascular remodeling and smooth muscle cell migration, as well as it stimulates the fibroblast growth for collagen synthesis. So it has multiple functions. It induces vascular remodeling. It also causes smooth muscle cell migration. It stimulates the fibroblast growth for collagen synthesis. Next one is the metalloproteinases. Metalloproteinases has important role in tissue remodeling. Tissue remodeling, it is basically a step where living tissue is structurally reorganized or renewed. It is done by the metalloproteinases. And the last one is the epidermal growth factor. It stimulates the cell growth via tyrosine kinases, for example epidermal growth factor receptor. So these were some of the mediators that are involved in the process of wound healing. Next are the phases of wound healing. So basically there are three important phases of wound healing. First of all, there is inflammation up to 3 days after wound. Next is the proliferative phase that occurs from day 3 to weeks after the wound. And the third one is remodeling phase, which occurs 1 week to 6 weeks, and it can occur up to months after the wound. First of all, we will see the inflammatory phase, in which inflammation will occur. First of all, the cell involves are platelets, neutrophils, and macrophages. Whenever there is a wound, there is any injury, first of all, there will be clot formation with the help of the platelets. Platelets come and aggregate at the site of injury, and they will form a clot. There will be increase in vessel permeability, and neutrophils will come to the site of injury via the chemotactic factors, and macrophages, they will clear the debris over the next 2 days. So there will be breakdown products of complement activation, chemokines that are released from the activated platelets, and other chemotactic factors will released that will recruit the neutrophils to the site of injury, as well as monocytes over the next 6 to 48 hours. And then these inflammatory cells eliminate the offending agents such as microbes that have entered through the wound, and they will clear the debris. As the injurious agents and necrotic cells are cleared, inflammation will be resolved. Now the next phase is proliferative phase that will occur from day 3 up to weeks after the wound. Now different cells will come in proliferative phase. These are fibroblast, myofibroblast, endothelial cells, keratinocytes, and macrophages. Other cells are also involved, like epithelial cells. They will come and they respond to locally produced growth factors, and they migrate over the wound and cover up the wound. Next are the endothelial cells. Endothelial cells will come and they proliferate to form the new blood vessels. They will be involved in the process of angiogenesis. Next, fibroblast. Fibroblast will come, proliferate, and migrate into the site of injury, and they lay down the collagen fibers. Collagen fibers that form the scar. Next, there will be formation of granulation tissue. Granulation tissue, it is very important. For example, there will be migration and proliferation of fibroblast. There will be deposition of loose connective tissue. and also together there will be blood vessels, and there will also be inflammatory cells. These all will form the granulation tissue. So granulation tissue will include the fibroblast, loose connective tissue, blood vessels, also the inflammatory cells. They also will form granulation tissue, which is a pink soft granular tissue beneath the scab of a skin wound. There will also be deposition of the connective tissue. So these were all the functions of cells. There will be deposition of connective tissue and type 3 collagen, that is important. There will be new blood vessel formation, epithelial cell proliferation to cover up the wound. There will be dissolution of fluid that was formed in the first phase, and then there will be wound contraction that will be done by myofibroblast, and delayed second phase of wound healing will be done in the cases of vitamin C and copper deficiency. So the last phase is remodeling, which can take up to months. It is done by fibroblast. Basically, there is a balance between synthesis and degradation of the extracellular matrix proteins, and this is done by metalloproteases that are secreted by the fibroblast. They are matrix metalloproteases. They are so called because they are dependent on the metal ions like zinc. So if there is zinc deficiency, there will be delayed wound healing. Now what the metalloproteases do is that they degrade the amorphous collagen and fibronectin, and in this way they cause the degradation of collagens and other extracellular matrix components, and they do the remodeling of the connective tissue. So these were all the steps of wound healing. So these are the three phases of wound healing. First of all, there is the inflammatory phase, in which there is formation of platelet plug, neutrophils and macrophages will come, and they will clear the microbes from the wound area. Next, there will be proliferative phase, in which there will be granulation tissue formation. Granulation tissue will contain fibroblast, connective tissue, some inflammatory cells and new blood vessels. And the third phase is remodeling, that will be done by metalloproteinases, and they will cause connective tissue remodeling. The degradation of collagen and the extracellular components will take place. So these was all about wound healing.